Welcome to our quarterly Employee Awards and Recognition Ceremony. We are here to recognize our team of dedicated employees for their contributions to serving our nation's heroes. My name is Catherine Bird. I'm an education instructor in the Employee Patient Experience Service. Our department is designed to enhance our employee and veteran experience and to ensure we continue providing world-class care to our veterans throughout Northeast Ohio. To our awardees, this is a proud moment for you and an exciting moment for us. In addition, we welcome our executive leaders, managers, supervisors, and service chiefs who have come to honor, recognize, and support our awardees. Following the ceremony, we will have a reception for our awardees. Please welcome our Acting Medical Center Director, Dr. Tim Hyman, to provide opening remarks.
All right, thank you all. First award ceremony for FY26, and I think it's appropriate just to reflect a little bit on FY25. And I think all of us have some ups and downs and some highlights and some not so great moments from any fiscal year, but it's been a very interesting, fun-filled, challenging, opportunistic year for us. I think the way that I view all of this, being here about 18 years now, is every year has the ups and downs and challenges and successes. But the one thing that consistently our VA does to stand out is never lose sight of what the mission is. We take care of our veterans. Our quality standards are superior. We are well known throughout VA and throughout private sector for the successes that we have. And that's all because of the things that you all do every day, regardless of distractions, regardless of what's going on. We are here for veteran care. And we get the opportunity quarterly to provide some of those awards to a few of you, but truly we have lots of staff that do wonderful things every day, and our outcomes and our reputation and the veteran care that we provide speaks for that. So thank you, congratulations to the folks we'll be recognizing today, and we'll get started. We've got lots of awards to hand out, so thanks so much.
Thank you, Dr. Hyman. We will now begin presenting our first awards, starting with the Length of Service Award. VA Northeast Ohio Healthcare System appreciates its employees. Employees make VA not just a job, but a career. It is essential that the VA has experienced and knowledgeable employees to support the mission of the VA. VA Northeast Ohio Healthcare System acknowledges employees with service awards to demonstrate its appreciation for these employees. I am privileged to call up these employees to receive their Length of Service Awards. Please hold your applause until the employee in the service group listed have been announced. Please welcome our Chief of PCAS, Dr. Julian Capito. Please join us at the podium to honor these awardees from Engineering, Facilities Management, Fiscal Services, Informatics, and Analytics. "40 years, Adrian Jones, Finance. "35 years, Jonathan Like, Health Informatics. "25 years, John Jones Jr.'s Finance. 20 years, Michael Benedito, Health Informatics. Heather Mangello, Health Informatics. Timothy Wozdovich, Facilities Management. Thank you, Mr. Capito. Dr. Massaro, Chief of Staff, please join us at the podium to honor these awardees from Audiology, Dental, GREC, Medicine, Physical Medicine and Rehabilitation Services, Psychology, Psychiatry, Radiology, Social Work, Specialty Care, and Surgical Care. 40 years, Esmeralda Simmons, Library. 30 years, Deborah Catania, Specialty Care. Heather Chapman, mental health. 25 years, Elizabeth Bishop, primary care. Thomas Eaton, physical medicine and rehabilitative services. Elaine Kalous, audiology and speech. Robert Mahaffey, social work. Frank Manco, dental. Pamela Schur, mental health. Lori Tomaszewski, physical medicine and rehabilitation services. Ricky Williams, mental health. 20 years, David Canaday, GREC. Marcus Donald, Chief of Staff Office. Jennifer Engel, surgical care, optometry. Paul Fantuzzo, primary care. Ashley Folks, specialty care. Michael Dobos, surgical care. Ronnie DeWalt, radiology. Michelle Mercurio, specialty care. Rhonda Murad, specialty care. Patrick Orlando Jr., diagnostic imaging. Kimberly Schaub, mental health. Ashley Sokola, chief of staff office. Donald Woods, surgical care. Shui Su, surgical care. Simrang Singh, chief of staff office. Yusha Stiefel, specialty care. Thank you, Dr. Massaro. I'm sorry? Oh. Thank you, Dr. Mazzaro. Acting Director Dr. Timothy Hyman will honor these awardees from outpatient clinics and pharmacy. 35 years, Linda Fitzpatrick, community care. David Roberts, community care. 30 years, Mary Lowe, pharmacy. Martha Mazak, pharmacy. 25 years, Antonio Carson, pharmacy. Christine Hurd Clem, community care. Kimberly Johnson, community care. Christopher Lacey, pharmacy. Mark Whitlock, community care. 20 years, Amy Anderson, pharmacy. Matthew Creed, community care. Michael Graves, community care. Carrie Hayes, pharmacy. Stephen Morrell, community care. Angela Payton, community care. Scott Sefcik, pharmacy. Eric Vignal, community care. Let's have a round of applause. Robert Jastrom, Associate Director, will honor these awardees from Environmental Management Service and Police and Safety Service. 35 years, David Watson, Environmental Management Service. 25 years, Terry Lavelle, Environmental Management Service. 20 years, Mark Bellini, Police and Security. Brian Walker, Environmental Management Services. Thank you, Mr. Jastrom. Nope. Ms. Katina Stone-Jones, Associate Director, will honor these awardees from External Affairs, Logistics Supply Chain Management, Nutrition and Food Service, Prosthetics, Patient Care Administration Service. 35 years, Kent Shelco, Communication and External Affairs. Years, Angela Fox, Patient Care Administration Service. Curtis Owen, Supply Chain Management Logistics. 25 years, Jeffrey Luckring, Nutrition and Food Service. 20 years, Jill Marino, Prosthetics and Sensory Aids. Galatia Richardson, Nutrition and Food Service. Thank you, Ms. Stone-Jones. Ms. Kristen Guadalupe, Associate Director, will join us to honor this awardee from Quality and Patient Safety Management. Megan Tobin, Quality and Patient Safety. Mr. Garrett Schreier, Associate Director of Patient Care Services, please join us to honor these awardees from nursing, mental health, specialty care, surgical care, and sterile processing service. 35 years, Love Fugs, mental health. Years, Jean Fortune, specialty care. 25 years, Sherry Ball, surgical care. Timothy Lloyd, mental health. Michael Mayfield, mental health. Donald Stratford, mental health. 20 years, Carrie Auerhammer, perioperative services. 'Teresa Faris, mental health. Brenda Hartman, GEC. Alexandria Casaros, ambulatory care. Janice Lewis, sterile processing. Thank you, Mr. Schreier. This quarter, we have a few special awards. First, we have our VA Northeast Ohio Healthcare System Peer Specialist of the Year. Joyce has been an invaluable peer specialist in psychology service, contributing significantly to the IPV and MST teams, which earned her the title of 2025 Peer of the Year at our facility. In 2024, she was selected to present a poster on intimate partner violence outreach at the Women's Mental Health Peer Support Services National Conference. Joyce also serves on the National Megabus Peer Support Advisory Council, providing insights on human trafficking. She became a certified WOVEN, Women Veterans Network provider in 2024, successfully completing training on consultation with 2 cohorts and introduced this critical resources to veterans at the Cleveland VA facility. Additionally, she plays a key role in the local planning team for both Domestic Violence Awareness Month and Sexual Assault Awareness Month, and has initiated a virtual pet parade to raise awareness about domestic violence. One of Ms. Wembley's nominators highlighted her empowering influence, stating, "Joyce believes so deeply in veterans that she empowers them to believe in themselves. Her genuine encouragement fosters change in ways that would not be possible without her coaching, support, and positive affirmations." Please welcome Joyce Wembley, peer specialist from psychology. Next award is the top VA Live Whole Health Award for 2025 VA 2K Walk and Roll. The VA Northeast Ohio Healthcare System has been named the top VA facility in the country for its 2025 VA 2K Walk and Roll, earning the Department of Veteran Affairs Live Whole Health Award. This honor acknowledges our facility for their exceptional engagement of over 1,000 participants, including 357 veterans and community members, as well as 732 employees, raising an impressive $17,500 to support homeless veterans, the highest amount raised nationwide. This award is a reflection of who we are, stated Jill Dietrich Mellon, Director of the VA Northeast Ohio Healthcare System. It demonstrates our deep commitment to our veterans beyond clinical care and throughout our entire wellness journey. The VA 2K Walk and Roll, held from May 19th through the 23rd across Northeast Ohio, included group walks, movement breaks, whole health coaching, and virtual participation from 12 regional outpatient clinics. This week-long event prompted physical activity, social connection, and community service. The turnout was incredible, but the energy was what truly moved me, said Catherine Dignan, Employee Whole Health Coordinator. The commitment to wellness and to each other was palpable, not just physically, but emotionally and socially. Our facility will receive an additional national award for raising the highest donations among all VA facilities. Veterans and staff can continue their wellness journey year-round through activities that support physical, emotional, and social well-being, such as creative arts, movement-based programs, nature-based activities, and healthy living workshops. Please welcome Dr. Rosalie Diaz, Ashley Pemberley, and Jeremy Stream to come up and to represent the whole health team. And Catherine Dignan, I apologize. It is now time to congratulate the award recipients of the following awards and certificates: the Daisy Nurse Award, Daisy Nurse Leader Award, Great Catch Awards, Employee of the Month, Eye Care Project Award, Hero Award, the LDI Graduate Certificates. Mr. Garrett Schreier, please join us at the podium to honor the Daisy and Daisy Nurse Leader recipients. The first is the Daisy Award. The Daisy Award is the international award that recognizes the superhuman work nurses do for patients and families every day. This award gives staff, patients, and families a way to express their gratitude for the compassionate environment nurses provide. Their exceptional and compassionate care is demonstrated by the VA's core values of integrity, commitment, advocacy, respect, and excellence. All VA Northeast Ohio Healthcare System RNs and LPNs are eligible for this award.
Good morning. I've been a patient here at Lewis Stokes VA Medical Center since January 2025. I noticed that an old rotator cuff injury was keeping me awake for 3 days. The Lord sent me an angel, but wouldn't you have known it at first glance because she had no wings? Her name was Chris Volkasek, an RN in the intensive care unit. The excruciating pain disappeared after only 2 treatments. What a blessed nurse Chris is indeed. I cannot quote her exact words to capture her special way of treating her patients, but Chris deserves far more than the recognition and praise. In my book, Chris is at the top of the list of all employees at the Lewis Stokes VA Medical Center because of the very professional manner in which she performs her job. There is a lot more to dispensing good medicine than prescribing pills for the patient. Listening intently and trying to understand what's going on inside the heart and soul is of great importance too. Listening to our own bodies can warn us that we must take action now to start the healing process. And with a little bit of love and compassion, a good practitioner like Chris can lift the soul and spirit to great heights. And Chris certainly does all of that. May God be with her always. Please congratulate Kristen Volkasek, RN, MICU. And I will tell you, that was probably one of the most moving Daisy Award ceremonies that I've ever gotten to be a part when we got to present that to Chris. She is one of the most sincere and compassionate nurses I have ever met. I'm assuming she's not here today because she works night shift, but it was an absolute pleasure to give her this award. It was very, very emotional. So I'm excited to do the next one. This one is for our nurse leader for the last quarter. As a CNS and a nurse for over 30 years, I have worked with numerous nurse managers with diverse leadership styles. I am aware of the essential skills needed for leadership roles. Working with Dustin Glass for 3 years, I am impressed by his ability to guide, motivate, and influence his ED team positively. Dustin views leadership as a role to drive positive changes rather than just a formal position. He understands clinical practice and organizational dynamics, fostering a supportive environment with open dialogue. He maintains an open door policy, prioritizes communication, positive patient outcomes, and recognizes staff performance. We meet weekly to discuss quality improvement, analyze data, and implement continuous improvement strategies. Dustin values collaboration and has led to improvements in triage times, discharges, contamination rates, space allocation, staff hiring, and opening a remodeled department. He emphasizes professional development and continuous learning to ensure staff competency in delivering high-quality care. Our trusting working relationship allows us to collaborate on projects to provide high-quality patient care and foster a resilient team. Please congratulate Dustin Glass, BSNRN, Manager of the Emergency Department. Thank you.
Thank you, Mr. Schreier. We will now present the Great Catch Awards. Patient safety reporting is important to improving patient care, decreasing adverse events, promoting awareness of possible adverse events, and becoming a high reliability organization. Great Catch Awards are a patient safety continuous improvement initiative to encourage staff to recognize and prevent adverse events. This quarter, we recognize a few employees who received the Great Catch Awards between June and September 2025. Please welcome Tanya Norwood from Patient Safety, who will present these awards. We'd like to congratulate and recognize the following employees for their great catches.
Good morning. Our first Great Catch Award for June actually happened on 5B, and there was a duo who had remarkably displayed dedication for our veteran safety. With this event, there was a cabinet that unexpectedly became unstable and began to fall toward a veteran. Thankfully, these nurses were present and was able to intervene just in time so that the veteran was not harmed. However, to take things a little bit further, the two members decided to check the entire unit. Upon their assessment of the unit, they found multiple cabinets that were not secure and quickly took measures to ensure that each issue was corrected. Please help me congratulate Vivian Frennick and Jocelyn Wolf. For the month of July, after surgery, a veteran patient wanted to leave the facility, but was confused and he lacked decision-making capacity. He did not understand his medical care needs, and during this time, the patient was also medicated at times for agitation. But overall, the RN was able to keep him reasonably calm. When ambulating, the veteran also needed assistance getting in and out of bed and also with toileting. At one point during the veteran's admission stay, he began to fall at the foot of the bed. However, the RN was not only there to keep him calm, but also to help assist the veteran to correct his balance and safely guide him to the floor to avoid a fall. Upon assessing the veteran, the medical staff and MD noted that there were no overt injuries and the patient was safe. Please help me congratulate Cynthia Chisholm. For the month of August, This team member encountered a patient in their clinic that was scheduled for an elective procedure. During the routine physical exam, it was noted that the veteran had a left carotid bruit. This was not previously known. So the provider followed up, ordering a duplex scan, which confirmed a severe left carotid artery stenosis. As a result, the patient was able to schedule and have the left carotid endarterectomy within 20 days of his initial exam. Had the provider not been as thorough as she was, it is likely that the patient could have experienced a stroke in the near future or even sooner during their upcoming elective surgery procedure. Please help me congratulate Emily Rito. And then our last Great Catch Award for the month of September, a new cancer diagnosis was posted for a veteran. However, the nurse identified a discrepancy in the report's classification, which was unfamiliar because the specimen had been sent out to CCF. To take it a step further, the nurse brought this to the attention of the reporting pathologist, who promptly contacted CCF for clarification. Without this clarification, the discrepancy could have significantly impacted the correct distinction between a low-grade cancer or a high-grade cancer. To prevent future occurrences, a JPSR report was sent to the Patient Safety Department, and the issue was investigated, resulting in resolving the issue to ensure that further instances like this would not reoccur. Please help me congratulate Teresa Nedelkovic.
Thank you, Ms. Norwood. Our next are the Employee of the Month Awards. VA Northeast Ohio Healthcare System strives to recognize individual employees who make contributions in support of the mission, organizational goals and objectives, and the VA strategic plan. This monthly award recognizes outstanding employee efforts during a specified period, as evidenced by peers, customers, and management. The employees that are chosen for this award are nominated by other VA employees. A committee reviews the nominations and selects the awardee. Please welcome to the podium Pam Pendleton, EPES Chief, who will present these awards.
Our July Award. During a Sentinel event at the Employee Garage, Major Nemi spoke with an obviously distressed veteran. Both being Marines veterans, they developed a quick rapport. The veteran said he wanted to jump off the employee garage. Major Nemi spoke with the vet and calmed him down, showing him care and empathy. The vet returned to the medical center for his appointment. A short time later, Major Nemi encountered this veteran again. The vet said he was going to jump off the garage. Major Nemi placed his arms around the veteran, who immediately began crying. Major Nemi escorted the vet to the ED, where he was evaluated by mental health. Major Nemi showed great compassion and dedication to the VA mission by embracing this veteran in his time of need, potentially saving his life. Please congratulate Major William Nemi, Police Service. Our August Employee of the Month. Eric began his workday on August 9th before dawn, volunteering to assist with the setup, support, and tear down of the new Philadelphia Vet Fest. By the time they returned to Wade Park in the early evening, both employees were both exhausted from working under the intense sun and heat all day and were eager to get home. Eric departed for home about 2 minutes ahead of his coworker. As I pulled out onto the road, I noticed his truck parked by the sidewalk where he was assisting an elderly veteran with a walker. Eric explained that he had seen the gentleman in the distance, struggling to get back up with his walker after a fall. Eric walked slowly and carefully with the frail man along Magnolia Avenue, protecting him from further falls or injury and ensuring he made it home safely. When I told Eric he was doing a commendable thing, he shrugged it off. Despite feeling as exhausted and sunbaked as his coworker was, He could have easily driven away and left the assistance to other bystanders. Instead, he made a lasting impression on the veteran and demonstrated a remarkable example of commitment for all of us. Please congratulate Eric St. Clair from engineering. Our September Employee of the Month, Dr. Adriana Lombardi, stepped up as the team lead for the Behavioral Health Interdisciplinary Program at the Canton Mental Health Outpatient Clinic, an incredibly demanding role given that the BHIP team oversees the mental health needs of approximately 1,922 veterans in the local area. On her very first day, Dr. Lombardi tackled the complex needs of an ongoing patient care case with remarkable efficiency. Dr. Lombardi led collaboration efforts with New Philadelphia Mental Health Outpatient Clinic team to ensure a veteran experiencing suicidal ideations would be able to meet with a therapist for same-day services, and maintained her composure and demonstrated insightful, thoughtful considerations. Further showcasing her exceptional leadership, Dr. Lombardi adeptly managed a crisis call that required police intervention due to safety concerns for both the patient and the patient's family. She exhibited extraordinary care for all parties involved, including the veteran's family, and clinical personnel. Dr. Lombardi also played a crucial role in guiding the mental health clinical team in exploring standard operating procedures and clarifying uncommon service requests, further proving her competency and commitment. In just 1 month, the morale at the mental health clinic has soared, revitalized by her leadership. Our clinicians are inspired and unified beyond her efforts. Dr. Lombardi exemplifies dedication and passion for the well-being of her patients, her coworkers, and the Department of Veteran Affairs as a whole. Please congratulate Dr. Adriana Lombardi, Pharmacy Service Mental Health.
Our next awards will be the iCare Awards and the iCare Project Awards. The iCare Project Award recognizes projects which exemplify the iCare values: integrity, commitment, advocacy, respect, and excellence. These projects are not limited by topic or source. The project should demonstrate continuous improvement, patient satisfaction, and commitment to caring for veterans. These projects can also highlight research and innovations in care. The actions being recognized should have occurred during the past year. The iCare Project Award is presented for excellence, strive for the highest quality and continuous improvement. Be thoughtful and decisive in leadership, accountability for actions, willing to admit mistakes, and rigorous in correcting them. Our Q4 iCare Project Awards and winners. The first one, Movement Approach to Support Physical Health of Veterans. In fiscal 23, the VA Northeast Ohio healthcare system saw improvements in veterans' mental health through whole health programming. However, physical health improvements were limited due to the lack of VA-led physical activity programs. To address this, the goal for fiscal 24 was to introduce more physical activity opportunities at our facility and in the community. New programs were started for different fitness levels, including cardio drumming, Fit Friends, stretch and movement, prenatal yoga, national parks hiking, kayaking, and salsa dance. The team partnered with community organizations to implement these programs, managing administrative tasks and providing necessary coverage. These efforts led to reported improvements in veterans' physical health. Some programs were also extended to the community-based outpatient clinics and the parks. Future goals include increasing class attendance to at least 7 participants per session and expanding in-person movement programs to at least 5 locations by the end of fiscal 26. This progress has been a source of pride, and we are committed to supporting veterans' physical health through these programs. Their dedication has significantly improved the physical health of our veterans, reflecting the core values of iCare. Please congratulate Kareem Cole, Rosalie Diaz, Catherine Dignan, Jeremy Stream, Dana Peterson, Ashley Pemberthy, and Anastasia Williams. The next project, the influenza vaccination screening and administration in acute care setting. In 2021, the VA Northeast Ohio healthcare system found their flu vaccination rates were 12% below the national average, increasing veterans' risk for severe flu complications. To address this, they launched a plan in August 2022 to boost flu vaccination rates among hospitalized veterans by 25% by early 2025. The plan involves several actions: using smart tools to check and give flu vaccinations during admission and before discharge, documenting vaccinations with detailed notes, and creating a computer dashboard to track vaccine needs. Leadership oversight, regular reporting, educational materials, and training for nurses and leaders were crucial. The results were impressive. By the first quarter of 2023, compliance rates reached 100%, up from 73% in early 2022. Yearly rates also improved greatly, 96.4% in 2023, 97.69% in 2024, and a projected 96.41% by the end of 2025, all exceeding national and VISN averages. Key success factors included engaged leadership and staff, standardized processes, mandatory electronic medical record checks, and consistent progress tracking. This initiative underscored the importance of clear improvement tools and stakeholder engagement. Going forward, the health system plans to maintain high flu vaccination rates and consider applying this model to other preventative care measures. Please congratulate Daniel Rios, Celia Berry, Bradley Bennick, Delisa Delt Can, Elizabeth Edmiston, Heather Erdl, Shireen Leffridge, Kimberly Michael, and Jesse Moy. The next project, moving the needle on timely mealtime insulin administration. The VA Northeast Ohio healthcare system aims to meet stringent guidelines for blood glucose monitoring, insulin administration, and meal coordination as recommended by the American Diabetes Association. However, they noticed their compliance with coordinating point of care, blood glucose testing, and mealtime insulin administration on acute wards was below the benchmark. The Nursing Service Standard Operating Procedure requires POC blood glucose testing to be done within 60 minutes before a meal and insulin administration. To address this, the facility initiated quality improvement efforts using the Plan Do Study Act cycle, involving input from the Joint Commission Advanced Inpatient Diabetes Certification Committee, Nutrition Services, and Nursing. They implemented various process changes with regular updates from diabetes education teams on SOP guidelines and data trends. Initially, the average compliance rate was 79%. After implementing the changes in June 2024, compliance improved, reaching 84% by February 2025. This data, initially collected on acute wards, is now used by community living center and acute psychiatry teams. Diabetes nurse educators also send monthly compliance emails and hold in-person staff huddles. Through dedicated and collaborative efforts, the facility has notably improved compliance rates for blood glucose testing and insulin administration, ensuring safer and more effective care for diabetic patients. Please congratulate Leslie Andrews, Jessica Banks, Kimberly Davis-Saver, Mary Ellen DeSmit, and Kimberly Michael. We will now present the Hero Award. The National Hero Award recognizes staff members who advance VHA's journey to high reliability by demonstrating VHA's high reliability organization principles in action. These may include going above and beyond in patient care or workplace safety, making a change in a process or procedure that positively impacts patient care or workplace safety, serving as a role model or a peer champion of HRO, or leveraging safety practices to perform well in a crisis or an emergency situation. Nominations can be submitted in 4 categories: clinical individual, non-clinical individual, clinical team, and non-clinical team. Any individual can submit a nomination to recognize a group or an individual. Nominations are accepted on the running basis, but are reviewed quarterly on the local level, and awardees in 4 categories are selected. These selections are further nominated to the VISN 10 level of Hero Award, and if selected by VISN 10, are then submitted as nominees for the National Hero Award. Please welcome Andrea Macarella to read this nomination and present the award.
Good morning. I'm very happy to present our individual non-clinical hero award to Matthew Donathan. Matthew recognized the need for improvement for scheduling veterans for their appointments. He discovered that when a consult was placed for veterans to be scheduled, they were not meeting the 3-day standard for the medical center. Matthew took it upon himself to interview several veterans, supervisors, and providers, and determined that veterans were not answering the phone because they did not recognize the number. Matthew created an innovative way to assist veterans with scheduling. He created a smart business card and hub that allowed veterans to save their specialty clinic phone numbers into their phone, schedule their appointments, and check into their appointments. He also created a link that includes a profile to each of the clinics and a hospital map and a provider information. Matthew has improved access to care and improved veteran care and safety. He understands the principle of sensitivity to operations, reluctance to oversimplify, and get to the root cause. The number of canceled contacts has decreased. Over 800 veterans are currently using this tool. Please congratulate Matthew Donathan for the Hero Award today.
We will now present the fiscal year 25 LDI graduation certificates. The purpose of the Leadership Development Institute, LDI, program is to develop employees toward increasing levels of leadership, responsibilities, and how to better serve our veterans. The following employees have completed the comprehensive and robust curriculum: Bradley Bennick, Dr. Lauren Brown, Matthew Busa, Deandra Gant, James Holmes. I'd like to welcome at this time the co-LDI chair, Jeff Snowden, to say a few words.
Good morning, everybody. The LDI awards that we just gave today came to a very few exceptional individuals that were selected to participate in a leadership program, and they competed against 20 other candidates. This is a year-round program and allows us to actually build leadership skills and bring those folks further along to enable us to strengthen our leadership community within the VA. So I just want to take a minute and recognize them again, all right? Thank you very much for everything you did. I know you had a hard year, all right, with Bradley, Laura, Matthew, Deandra, and James. Thank you.
Thank you, Mr. Snowden. So in closing, I would like to say congratulations to our amazing awardees. Thank all of you for supporting them. Awards not presented today will be delivered within the next week to the chiefs and administrative officers of the service for distribution by the Chiefs. All awardees are invited to the reception in their honor. We have some goodies there in the back. Thank you and have a great afternoon.